would call them reversible causes, or maybe let's say causes that we can actually do something about. For example, those who like nose picking. Of course, when they stop picking their noses, then
yes.
Then of course, if they stop nose picking, then now definitely the epistaxis will resolve. If a patient, let's say, had a foreign body in the nose,
yes.
then of course, once we have the foreign body out, then they're sorted. If a patient had a tumor, let's say, for example, a very common tumor in teenage boys is usually juvenile nasal angiofibroma, abbreviated as JNA. So JNA would have this nasal blockage, epistaxis, starts around the teenage years. And then these are the patients who we would have probably investigated. So we've tried the nasal packing, it's not working. Then we look into the nose and we see this mass in the nose. So of course we'll do our CT scans, our radiological investigations, and find out which blood vessel is feeding this mass. Then we're able to tackle that blood vessel either by blocking it or clamping it, and then eventually removing this mass from the nose that now cures your nose bleeding. So of course there are reversible causes. Then there are causes that might be in the family, but we can manage them. Like Dr. Angela mentioned, patients who have hemophilia, then we might be doing more frequent of blood transfusions and stuff. And those ones will help now keep their blood levels in check, which will also help to control their epistaxis. Yes.
And of course, I'm picking that there's some medication you're going to have to cut off if it does have to, you know, cause that. Dr. just let me go back a little bit because we're about to wrap this up. When you're talking about managing, and I really